dry to warm up. And then thumb lead the metatarsals is this sort of the same movement that we've done before around the scapula, but we're just doing in between the metatarsals, okay? Now it's quite a precise movement because we've only got a small area that we can actually work on. I'll go to the little toe, and when you come up to the tarsals, then you stop, so you don't go right the way over the bony tissue, okay?
Both thumbs.
Both thumbs, literally pushing, circle, push, circle. Now if you find that difficult, if you've got very, very tiny feet and you've actually got quite big thumbs, you can just do this lovely drain. So you can use two and get the same effect, two different ones and get the same effect, depending on your thumb. What I don't want is this. I don't want to see you using your index finger. You need to be using your thumbs, okay? So that's the metatarsal kneading. And then we've got the frictions across the phalanges, so supporting, sorry, we're starting with the little toe. So supporting their foot at the top, just literally nice, strong movements, okay, and then a stretch. Working the joint areas as you go along. Obviously, you make sure that this person hasn't got any contraindications, so that there's no tinea pedis, there's no hammer toe, and there's no bunion anywhere, because it could be quite painful for them, okay? And then when you get to the big toe, change hands and just literally work the big toe side. Yeah? Okay. Then we're going to do cross frictions on the plantar side. Again, you know, make sure that your posture is good. You don't really need to get down to see what's going on. iTech will allow you to kneel on the floor. However, the problem with that is that you've got to get up. Okay, and if you're kneeling on the floor and then you pull yourself up using your partner to help you up, it's not going to get a very good result. Okay, so if you can, I'd rather you do this sort of thing. Now I think what iTech will agree to is rather than kneeling on the floor, you can get down and do this. Okay, do it this way. But again, I find this very difficult because I'm getting older to get up. Okay, so what you need to do is unfortunately take one hand away and just keep the other hand supporting. You just literally pull yourself up. Okay, but don't use both hands on the person to pull yourself up. Okay, that's a nice stretch. Let it go. That's it. Lovely. There we go. Okay. All right. So now we've done